Here's how to submit a case to ClearCorrect. Before you begin, have your patient read and sign an informed consent and agreement. It's important for your patients to understand the risks and benefits of clear aligner therapy. Keep this for your records. You can download this form from our Help Center at support.clearcorrect.com. If you prefer to pre-fill a submission form by hand, you can find a pre-submission worksheet on the Help Center as well. These are for in-office use only. We won't accept PDFs or paper forms sent via fax, email, or shipment. All cases must be submitted online. When you're ready, log in to doctor.clearcorrect.com. Click Submit a Case in the upper right corner. Choose your practice and click Next. In the next section, enter your patient's name, date of birth, and gender, and let us know whether you're treating one or both arches. By default, we'll plan treatment with the minimum number of steps recommended to try to achieve your prescribed goals. If you choose to limit the duration of treatment, we'll honor that restriction, even if it means stopping short of your other goals. The default wear schedule is 2 weeks per aligner. If you prefer a longer or shorter wear time, let us know so we can stay in sync. The wear schedule determines when shipments will be scheduled and when the case will be closed. The next section asks for the patient's chief complaint. Don't just tell us the patient wants straight teeth. There should be a clear summary of the conditions you want to address. For example, uneven maxillary anteriors with minor overjet and misaligned midline. Then, specify the patient's midline, canine, and molar relationships. In the next section, you choose whether you want to maintain, improve, or idealize various conditions. The default option for most conditions is to improve them as much as reasonably possible within the selected case type. The molar relationship and posterior crossbite are difficult to adjust with clear aligners alone, so we maintain the existing condition by default for those conditions, rather than planning movements with a low chance of success. Idealizing means to move the teeth on the model into an ideal position, even if the movement is unlikely or might take longer to achieve. By default, we recommend interproximal reduction, adding engagers, and proclining, expanding, or distalizing the teeth as needed. If you definitely do or don't want these options, let us know here. In the next section, you can provide additional instructions. Indicate any teeth that should not be moved, such as bridges or ankylosed teeth. You can also tell us to avoid placing engagers on certain teeth. If you plan to extract teeth before treatment, let us know so we can remove them from our model. If you want to end the treatment with open space between some of the teeth, let us know here. You can also provide freeform instructions at the bottom of the page. Again, the more detailed, the better. Next, it's time to upload your patient's photos. You can drag and drop image files directly into the gray drop zone, or you can click Select Photos to open a file selection dialog. You can select multiple images and click Choose or Open to upload them all at once. We require 3 headshots: a frontal view of your patient's entire face at rest, the same angle with your patient smiling, and a profile with no smile. You'll also need 5 close-up photos: occlusal views of the upper arch and the lower arch, and a clear view of the patient's right, front, and left. Make sure the posterior occlusion is clearly visible. In the next section, you can upload X-rays. X-rays are optional, but if you have them, we recommend that you upload them for more accurate treatment. In the next section, tell us whether the models will be based on impressions or intraoral scans. If you're submitting impressions, use PVS material. Alginate won't work, and neither will stone models. We need impressions for both arches, even if you're only treating one arch. Use disposable impression trays. Metal trays can't be scanned, and all physical records are disposed of after processing. If you have STL files exported from your scanner, drag them into the gray drop zones to upload them, or click the file selection links. If you select Directly Uploaded Scans, we'll keep an eye out for files uploaded directly from the selected scanner that match your patient's information. This works best if you submit your case on doctor.clearcorrect.com before uploading scans through your scanner's interface. When that's done, you'll be prompted to agree to ClearCorrect's current terms and conditions. These terms are updated periodically, so it's worth clicking the link to make sure you're familiar with the latest version. You don't have to pay to submit a case, and you're under no obligation. You'll pay the lab fee if you approve a treatment setup. After you click Submit, you can print a submission record. This is for your files. Don't submit this to ClearCorrect. If you're using PVS impressions, you'll also need to print a packing slip. Cut the slip in half and put half of it in the box with your impressions. You can use any sturdy shipping box, including the ones we use to send you aligners. Tape the shipping label to the outside of the box and drop it off at your nearest shipping location. After we receive your submission, along with valid photos and scans or impressions, you should receive a treatment setup within a few days. Review it, approve it, and pay the lab fee, and we'll start making aligners.